had a great break time. It's my pleasure to introduce our next speaker, who's going to talk to us about the emerging tools in cancer medicine, focusing on precision medicine and artificial intelligence. Nowadays, the term of artificial intelligence, machine learning, and data science are widely used in many industries. In healthcare, the computer algorithm is designed and used in a way to help the physician and scientist to translate big data to predicted outcome and targeted care. This is a subject that we should all be deeply interested. Our speaker today is a physician, a scientist, and an innovator. He's widely regarded as an expert in cancer therapy and diagnostics. He's also the board of director of Taiwan Buddhist Cystic Medical Foundation. Please join me in welcoming Dr. Yan Yun.
It's my great honor to give this talk, and thanks for your invitations. I'm actually part of Cystic family, so we are all together. And I started my career at the City of Hope Cancer Center, which is just nearby, and I've been there for 21 years. And then I've been recruited back to Taiwan and served my alma mater, Taipei Medical University, as a university president for 6 years. And I stepped down my presidentship last year, and then I spent more time at the Cystic and per master, and she wanted me to serve the board member, so that's what I'm doing right now. I'm an oncologist and a cancer researcher. So today I would like to share with you about precision medicine and what is in the future direction that mainly is related with the AI. Yeah, this is the DNA and this is the gene. And that has been a while ago in the year around 2000. And we human have the Human Project in the DNA analysis. About the year 2000, we announced we finally identify all the human gene, which is near about 30,000 genes. But that's not possible. It's very difficult to be accepted by every individual. You, me, we all look so different. We like different things. Our color of the hair are so different. How can we explain the difference from the 30,000 gene less? So there must be something else. So we feel joy when we identify the gene in year 2000. But quickly, we lost the hope because we don't know where to go. So we spend about 15 years of the time to figure out one thing. To conduct this whole symphony of our body, we need more than gene. DNA is just a building blocks. DNA is just a music note. There's an RNA, and there's RNA modifications. Same as modification to the protein. And the protein really played a role to run this whole orchestra. So that's from the music note to the melody, from DNA to the RNA, then to the protein. If you talk about the proteins, that is tons of protein in our bodies. And that makes the difference in you and in me. The hair look different, different top, width, etc. So in the year 2015, former President of Obama made the decision. In January, he declared this is a precision medicine time coming. This is a new era for the whole human beings, not just for United States, it's for whole human beings. That also means there's a budget tied in this precision medicine era. And also he appointed the former Vice President Joe Biden to take the spearheading of this task force. Why Joe Biden then? That's because Joe Biden, in his family, there's carry on some hereditary cancer. Brain tumor and the breast cancer recur in Joe Biden's family, and he suffered from cancers and cancer-related issues. So when Joe Biden carried on that, he formed a task force that is called Moonshot Project. And in Taiwan, we also joined the Moonshot Project, and I'm one of that still. And what we do is to identify the difference, the DNA, RNA, protein among all of us, normal, disease, family clustering, and others. So these are the precision medicine in the action plan. And if you look at the human nature, we never really jump our knowledge too fast or lifting. What we do is go by step by step. We can trace the back in the year 1886 when the priest Mendel identified his bean in his the vegetable garden. There is a DNA to make the bean bigger, smaller, twist, or straight. So that is the starting our genetics study ever since. And then gradually we identify DNA, wasn't click, and the headaches, etc. Most of the people here are medical professional, and you will know that very, very well. And the RNA. And in the RNA, in the past 20 years, we have 3 Nobel laureates coming from the RNA field. That's because so many new things. And then to the protein. So this is the whole 15 years from year 2000, identify the DNA and the gene and sequence. And then wait until 15 years later, we kind of understand what is reality about these changes and the complicated processing of the DNA. And that is also the reason why Obama announced 2015 is a precision medicine era. So that is actually a step by step, never been really jump. From this slide, you can see a very cute baby. And in fact, you and me stay in the United States long enough. We all know if you have a chance to deliver a baby, and baby will donate 1 drop of his or her blood to the national laboratory. And then the national laboratory will test for you about how is the baby's health condition. Literally, that's a genetic rare disease testing. Because if this baby carried a genetic rare disease, and immediately this baby is a part of the government's, because the government going to commit to save his life and also support his long-term care. And it's really a burden, but that is what we should do as a human civilization. That is a commitment we have to give the minority. If the baby is healthy, and then this baby should go to your parents to let them raise you happily ever. So this is very important. All the baby, once they born, they have to go to test the rare disease to determine whether this baby should go to which route. But that test itself used to be very tedious. Sometimes take 6 months to identify, and the young parent got a call from National Laboratory, say, hey, you have a healthy baby. There's a no-brainer. My kids grow so well, and you don't need to tell me that. I know very well. So that's become so ridiculous. But DNA detection changed this whole world. they can quickly identify whether the baby carried a rare disease or not in about 1 week. So that makes sense much more. And then you can see if the baby grows so well, then that's not just the end of the testing. And there's so many testing currently will be done for the whole life, literally. For example, lots of disease coming on from adolescent stage. And some pediatricians sit here. You may or may not know that is nowadays, the adolescent science become blooming, and then quickly, gradually, we'll move that into the clinical practice. That is because we identify a lot of genetic changes. They don't show until 10 years old or even 18 years old, that kind of range. So adolescent medicine become critical and important to guide us about whether patient has a early stage of disease. Any rare disease, if you can identify earlier, you can treat it. And some even can be controlled nicely for whole life. So that is very critical. Besides that, people sometimes use genetic disease to test the pregnancy. In the past, about the 16 weeks, you take the needle, put it into the pregnant woman's body, and then draw the blood or draw the fluid for testing. You are the doctor, you are the nurse. You tell the patient, say, don't worry, that won't hurt your baby. Of course, but you are actually scared to death because there's liability behind. Nowadays, we don't need to do that no more. We draw the one tube of blood from mother and then test what is a baby carry on in the genetic level. So that has been a standard practice. Also, there's many occasions when the marriage counseling will tell the young lady and the upcoming the young husband said, since both of you came from North European, you might carry on some disease called cystic fibrosis. So how about go testing? That has become part of marriage counseling components now. So precision medicine and the genetic testing becomes so critical and in every single steps. Needless to say, in cancer, there's 18% to 25% cancer carry the genetic abnormality, and that can be tested. So you can imagine this is actually carry your whole life through this precision medicine task force. And if you are looking into the further down, and you will find out that cancer itself is really a major disease, carry precision medicine and become its mainstream of the diagnosis. In the past, we needle biopsy a breast lump, for example. You send it to pathology, and the pathology look at the cell. Say, this cell look abnormal. It is a possible cancer. That's because the evaluation based on nuclear size, cytoplasm ratio, and the color, the shape, etc. And if there's an uncertainty, then they will send for special staining using the antibody to identify whether this is cancer versus normal, or look into what type of cancer, how aggressive this cancer about. But nowadays, through the precision medicine, we are testing the gene itself, rather than just look at the disease morphology, the shape and size. The first disease being approval using the genetic testing in our human nature, the history, is a cystic fibrosis. This disease comes from the one point mutation in the DNA, and that mutations happen to make the chloride pump failure. And for that reason, from that failure, the active chloride cannot be kicked off. So they stay inside of our body, particularly our alveoli, which is in the lung. And if the lung get damaged and become fibrotic through the inflammation process, just like a scarring. So cystic fibrosis come from one point mutation, become a very standard for our human medical history, using the precision medicine to make the diagnosis and then follow with the treatment. If we go further, using the common disease, such as breast cancer, and you can see it is a complicated disease, and they come from so many different backgrounds, but at least from 15 to 25% of the breast cancer, they have a family clustering. For example, the Hollywood movie star Angelina Jolie, she got a call from her sister who just got diagnosed of a breast cancer. So immediately that raised an alert to Angelina Jolie. And Angelina Jolie also go checked the DNA and find out she also carry this genetic gene called BRCA. And why they are so alert? That's because in Ashkenaz Jewish descent, they have a high risk to carry this gene, BRCA mutation, and also that induce the cancer, such as 70% of ovarian cancer and at least 50% of the breast cancer. That's the reason why even Angelina Jolie looked healthy, but she carried the mutated gene. So she went for the prophylaxis surgery to remove the ovary and then remove the breast subsequently. So this is a precision medicine impact to the health management as well as the medical decision. But that's only about 15 to 20%. The rest of the breast cancer, they are not in the family clustering pattern yet. That's coming from random mutation. Why you have a random mutation? Because in our whole life, we accumulate lots of mutation, but our body take care of that to get rid of this mutation. What's coming from this mutation? What is caused? Eating, lifestyle, stress, radiation, and many, many, many things. That's why since we are vegetarian, we kind of avoid some risk. That is good to know. And then that also precision medicine gradually changed diagnosis. Further down to the road, they changed the treatment and changed the drug discovery process as well. This slide is a very classic slide. We are identified in the breast cancer. There's a very unique gene called HER2 gene. The HER2 overexpression related with high risk of the breast cancer. And Herceptin is the drug specifically targeted on HER2 gene. So in the past, we say, oh, you have a breast cancer. Now we don't say that no more. We say you have HER2 positive breast cancer. And then you need to use Herceptin in your treatment. So molecular diagnosis, precision medicine become part of our cancer treatment, from diagnostic to the treatment, drug selection, and the prognostic value identification. So this becomes very critical. And besides the cancer medicine, rare disease medicine, as we mentioned at the beginning,
there's many other precision medicine tool coming in. We base on the diagnosis and make the drug selection. And this is the current status. People try to use this gene and make a panel, and use the panel for cancer, for specifically breast cancer, for cardiovascular disease, for neural disease. And why use the panel? That's because it's cheaper, faster. If you have a panel to put into the most common gene for the diagnosis, that go faster. So this is the current trend, and you heard about Ancestry. You heard about 23andMe, and these are all the genetic testing companies. And they are facing to the client. And FDA also allow them to directly go to the customer, called customer direct. And that is the big changes. In the past, all these kind of a tests have to go through us, medical profession. But now they direct a tap into people. And then people send a sample to 23andMe, for example. And then they collect the data, send to the patient. Patient say, I'm not going to read this. This is like a crazy. This is like so thick, and they talk about something I never know. And then they bring all the data to meet you or me. And then we say, I'm not ordered that. Why you get all these results? And now I have to take liability to interpret the data to you, to tell you about you do have 3-fold higher risk to get a diabetes. But then if you didn't get it, is this my fault or your fault? Why you do this without me? So that become a whole question about the problem. And the government doesn't know how to handle this. And company doesn't care about this problem. You and me, we need to know some of the knowledge behind. And when we interpret these precision medicine data or related recommendation, we have to be very alert about these data, sometimes collected, tested with bias. The bias coming from the company. The company plays some favoritism to something, some drug for the selection. So you have to be alert. You have to have enough knowledge. For example, this panel, why some gene in there, which is we feel is not important. That's only because there's a medication tied in with that. So be careful and also follow the knowledge. So pay a little bit more attention on your daily practice. That's good enough. But genetic testing is very important. It's also very good, as long as you know how to understand, interpret, and use that. For example, this slide show, some medication you gave to someone which is useless. But the other hand, the same medication to give to someone is so heavy. That's because metabolite. You metabolize the drug faster or slower. That's really matter about how you choose the dosage about this medication. And this knowledge called pharmacogenomics, pharmacogenetics. That's why you, me, we look different. We metabolize drug also different. So from there, you can see precision medicine is not just precision. It's a personal medicine. So it's all about you, your gene, your treatment, your drug metabolism. So that is very, very important right now. To accelerate this whole process, and we use a machine now. Usually the most common machine is Illumina and or the Roche 454, this kind of high-speed route of the equipment. So we have a tendency to use the panel to quickly diagnose the 4 patients, as I just mentioned that. And then we use some Okay, this is funny. Okay. We use a different machine. They carry different power to do different things. Some using for panel only, some are more research-like approaches. So these machines, we have so many choices now. So when you get the genetic data, you now know why people put a panel. You now know why they use a different equipment. That's because speed, accuracy, specificity, etc., etc. But very important is this world is moving very fast. So this slide shows at the beginning, genome sequencing is tremendous high price. Now it's down to less than $1,000 now. So if you test your gene, you are not go crazy. You just pay about probably $800. You get all your whole exome gene. But that data is so huge. Because this is huge data, so we ask for bioinformatician to collect the information and then analysis for us. So there's a new job. So if you have a young generation kids, they want to study something mathematics, that's great. They want to study bioinformatician, be a bioinformatician, even better, because they can guarantee their job and in a very good pay, because you and me don't know how to interpret this data. We need some middlemen to help us. They are bioinformaticians. But these massive data collected together beyond our human brain. That's why people start to look at any alternative way to interpret that. So that is the big data lead to the data mining. Eventually, beyond us, we now create artificial intelligence. Artificial intelligence move this precision medicine so fast. Artificial intelligence actually created about near 20 years ago, but up and down at least 3 times. Because the first time the machine learning come up, people think that is a Frankenstein that can be damage to our society. We better block that. That happened in England. And then gradually to the second waveland, and then further down to now, people not block the artificial intelligence no more because they tied in with health medicine. So the health medicine is very critical for every individual like us here. That's why artificial intelligence get a very stable status and to move further down. And if you talk about artificial intelligence, and something you need to see is this is a tremendous fast growth industry right now. And artificial intelligence supporting healthcare and start from the several years ago. But this is a slide done in year 2017. You can see their surge. This is a hockey stick growth. And all the big companies get into this field. Google, Amazon, Apple, every single company. Why? Because first they are focusing on the consumer. And then more important is they are tied in with our health management. So these are several things under precision medicine scope, supporting by AI. First come first is imaging. Because how many radiologists sit here? Probably less than 1, right? How many internists sit here? Probably more than 10, right? So you can see radiologists is a rare species, and they work so hard. They now try to use a machine to read for them as a first line. So before they change their eyeglasses, they change the AI in their computer. Let AI interpret the slide, the film for them first. Second is a pathologist. I know Dr. K is a pathologist, but how many pathologists are here? Probably not many, right? Pathologists use their eye like a crazy, and they read from microscope. So how about use AI to do the first reading first? Because the 90% slides are normal, and they need to focus on the rest of the 10% of the slide critically. So save the time, accuracy, etc. So putting together, gradually we believe that makes sense. So at the beginning, radiologists as well as the pathologists against the AI in precision medicine. Now they accept it very well because they can spend more time to make the diagnosis right and deeper, more accurate, and save their energy. Not saying they are going to play golf, but they may have a 4-day week and 3-day do Cystic. So that's better, right? So this is the first company get approval from the FDA for radiology AI. This company is located in Ohio, about 50 people, called Riverain. And the Riverain, this tiny company, they are not really AI savvy at all. They just try to help radiologists. When they read the CT scan, they always get trouble about the bone density interfere the reading. So they use the software, AI software, take down the bone density and make the CT scan easier to get interpreted. That makes sense from FDA's point of view. So they got approval. And that approval moving this AI imaging surged. And now we have about near 100 different companies to do this now. This slide is coming from my friend. They merged together the two task force together. One hand is Harvard Medical School. The other hand is MIT. So medical school and hospital provide the data to train the algorithm, and the MIT provide engineering, computing power to make sure we can improve the algorithm. But all of these work done in the cloud base. So AI is very relatively simple. There's 3 things, A, B, and C. Algorithm, big data, and cloud. Algorithm calculate the big data for you, and the storage or computing via the cloud. So it's A and B and C. And if you know that, you will feel more comfortable. But the first thing started is the artificial calculation. So this is a CT scan. You have to teach the machine to learn. This is tumor, this is artery, this is esophagus, this is a lung, and this is a bone. And you have to throw in thousands of film to teach them and correct them. This is right and this is wrong. Who has so that many films? And how can we standardize these films? That become a big challenge to the AI industry. So another thinking process is forget about these the annotation to these anatomical side, rather than just look into the film such like a pictorial. And you can teach the AI coffee, fried eggs, the plate. This is what's the interest about plate, etc., etc. So that is a pictorial learning. Just like when I was young, my mom told me, that is dog, don't touch that. Otherwise you will get a bite. So, and I start to realize, dog, bite, bark, don't touch it, right? Yeah, so that learning never being rationalized well. Just I follow my mom, okay? But reality is once I grow up, I become a dog lover. That is because built up from the trust. I know, look at the dog. If the tail go high, be careful about. Tail go down, he's nice to me. So that is from the second learning. So we all in the learning process in the whole life. Just like before you joined Cystic, now you are in Cystic. So you change your mindset right now. So by learning, there's many ways, not just the AI way to interpret or to just annotate. There's so many ways. And we are developing our own AI as well. And not just for medicine, from also the overall. And this is the pathologists. They work very hard, very, very hard at reading this microscope. And now we use the machine to teach them to read. They just remember the picture, or they remember annotation, whatever you like to do it. And then you can accumulate that learning curve, and then finally let the machine to teach you what is the cancer. And that is very important. And also, another way is to annotate by looking at the cell, from cell to the gland, from gland to the whole histology, accumulate. So either by pictorial or by annotation, cell, individual cell. There's many ways in between, actually. You can teach the machine to learn, yeah. And through learning, and then you can identify the disease. Even that is a little bit behind. Now we don't use a microscope. There is a special scope. You can go to look at the potential suspicious of lesion, identify the heat wave, and then use the infrared even, and go deeper to the molecular level, and even can identify what kind of gene mutation carry this kind of figure of the disease. So everything tied in more and more. And that is precision medicine 2.0 now. Is that just happen in the imaging or just happen in pathology? Of course not. The precision medicine is far beyond the hospital, same as AI. So you can look at here is the data. Data come from medical record. Data come from the clinic visit. Data come from the inpatient, ICU, etc., etc. You can group them all together and then calculate the reading, training by machine learning algorithm, and using what we call AI to back up our individual health care. And this is one of example in a sleep medicine. When you look at the sleep medicine wave, this is the wave that show abnormality, and then you make the diagnosis about what is the patient suffer from. They have obstructive sleep medicine or something else. But you know how difficult to make this sleep medicine? It's quite difficult. And you need to sleep into the sleep medicine center. Even now, people can do it at home. But that accuracy can only be encountered as a screening tool. And every night, the sleep center can only take 6 patients, cannot take more than that. That is because very difficult to make the interpretation about this wavelength. And always in the morning, and the technician will look at screening medicine data and then take it down. This is normal, normal, abnormal. Normal, 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 normal. So then they cut it, the abnormal, to the doctor. Usually it's a pulmonologist or psychiatrist, depends on their board certified or not. And then they will say, oh, this abnormal, that's because the patient sleep to the other direction and squeeze your apparatus. So that doesn't count. So that is judgment MD can put into it on top of the technician's calculation. But can you imagine if that usually happen in the Monday or Tuesday, all the technicians, they carry on unhappy move from the weekend. as compared to the Friday. They are rushed to leave for their long weekend. So that interpretation all count on human error. So how about teach a machine to read normal, normal, abnormal, normal, normal, normal. Machine can work day and night, and AI will support you with the good preliminary data. With that, and you can take more than 6 patients to 60 patients. Interpretation can be done right away. So this is AI can help you in many things. Another is a facial expression. As you know, that's lots of the doctor, when they face the patient is not going to tell you the truth. You ask, especially oncologist, I ask my patient, do you have a pain? The guy said, no, I don't have a pain. And then his wife said, you feel pain last night and couldn't sleep and bother my sleep. So I say, well, then how you scale your pain? 9 out of 10. Well, that's a lot of pain. So sometimes the medical record need to take from patient's facial experience, the tone, the verb they use, but how to calculate that precisely. The senior doctor say, hey, this is experience. You have experience accumulate and you can tell. But experience can guide you to the wrong direction. How about using the AI? So in the future, you will see your patient and take the notes. And then there's a scan, look at your patient. And they can identify the facial and then tell you this is not true. Yeah. Another thing is when you talk to your patient, the machine will learn and catch up through the Siri. We all have a Siri on our iPhone, a cell phone. So that Siri would identify that. So when you've done your interview with your patient, the medical record has been done. And then you just punch the key to make sure the pain is real or not real. And quickly, you can sign your name. That can make your medical practice much easier and friendlier, and you can eye to your patient again. Before, you are busy with writing your medical record, and you forgot to see your patient at all. So AI can help you to come back to the old tradition. See your patient eye to eye. And in the ICU, same thing. In the ICU, there's so many equipment, so many things, beeping, ringing, and the patient or the patient's families put in the nurse say, hey, this is beeping. Nurse say, it doesn't matter. This machine has been broken for a while. And then why you bother to keep here? We only see the trend. We don't see the signal only. So there's a lot of issue. Because the nurses and the doctor at the ICU, we really look at just a trend. The pressure down is one thing in front of us, but this pressure has been better than yesterday. That is the trend. So we are looking for the trend. We are looking for urine output, heart rate, etc., putting together. But who has such a brain to remember 2 weeks ago this patient coming in to your ICU bed 1 carry what kind of a pressure? I usually believe a nurse did better than the doctor. Doctors are going, oh, okay, good. Okay, then left. Okay, only the nurse putting, the doctor said, don't leave. This guy has a problem. His pressure is dropping. I said, well, the pressure is pretty good. It's about the drop from yesterday. And yesterday bed is worse than the day before yesterday. So who has the AI brain? Nurse. Nurse is better than MD. And so, but we have to let the nurse take a rest, right? It's too much work. So AI going to collect all the information for our nurses as well. So these are several examples I share with you. But once you go to the bigger scope, like we now call smart hospital. So that means that your gadgets at home and then your clinic visit, everything. So you put everything together into your medical record and then prescription information all together. That is AI going to do it for you in taking care your health. And don't forget all of these wearable. We are very happy to look at. I walked 10,000 steps today. I did not, of course. No, not yet. I will do so. But who going to record down that? Apple. Why Apple need to know this? Apple really take care of you? I'm not sure, because he cut my iPhone battery low, right? He never take care of me. So he's collecting the data from you. And your data supposed to be collected by yourself and your doctor, rather than Apple. So that is very important, as how we keep watching this information. So important is we need to build up this kind of a nice service around us, and with confidentialities, rather than leak out our individual information. So that is become very, very critical right now. And we need to, using the cloud, and then link with everything from your device, from your inpatient, outpatient, everything, through the Internet of the Things. And with all these data under your control, and as well as sharing with your doctors. And in Taiwan, we started using the Watson for oncology, Watson for genomics in helping our patients. They're apparently doing pretty well, but still have a lot of things to learn. But the learning is a difficult thing. So we have to understand our learning is to carry on for whole life, as we mentioned. But important is that the memory, the cognitive learning, is from frontal, and then digest, and then put into the hippocampus, eventually storage there to be your knee-jerk reaction. So thinking, cognitive learning, need to build up step by step from your frontal lobe, go down to the hippocampus. That takes time. You have to practice. And using this cognitive learning model, we train our machine to give them the data and then let them make a mistake and improve from 60% accuracy up to the 80, up to the 95%. So this kind of learning really is from the data accumulation, and then step by step changing the behavior, changing the decision, and changing the psychology, step by step by step. These are all the effort done from psychologists, neurologists, and the behavior scientists. Gradually start to understand all of that, and now using this information, put that into the machine to let the machine to learn, and that is all the AI about. And eventually, when 3-5 years down to the road, all these AI will go through these cell phone. The cell phone will remind you, you need to do your colonoscope. You don't like it, but he's keep bugging you until you say yes, okay. And then you go and then you get all the scope, the picture, they storage that. Next year they show you, you have a polyp removed, and then don't forget to redo it. And then further say, you already have a 3 scope show polyps. You should go for the genetic testing, because the hereditary polyposis does show happen like that. So this is down to the end of my talk. All these data need to be collected, but who's going to collect it, and how you protect that without leaking and wrongdoing? We now use blockchain. The blockchain is used for banker, but now we pay more attention in using blockchain to isolate your data information. So this is the final. Regardless what kind of technology, you have to go back to the patient care. Because if you ask the AI, say, hey, this patient is dying, and how much the life we still have? AI probably can tell you you have a stage 4 disease, you have a 2.3 months to live. But we are not that kind of doctor. We are the Cystic doctor. We're going to hold our patient's hand, say, regardless, the contract between God and you, I don't know, but I'm going to take care of you toward to the end. So we are not going to predict any life or longevity. We just provide the best care. So this is what we should do. And eventually, regards to AI, your heart is the most critical and precious. Year 2025, by prediction, we all going to enter the AI medicine. We just prepare ourselves. No need to be afraid. AI is our helper in helping precision medicine rather than replace us. Thanks for your attention.
So in the era of precision medicine, we'll now be able to develop, design the treatment, healthcare, and medication tailored to our individual needs. With the help of algorithm, data, big data, and also the cloud, we can now have the physicians to focus their time on patient care, on interpreting the results, looking at the trend to help them achieve the goals. So the most important lesson I learned from this class is that we now all have more time, save off work, and contribute to TUMA and volunteer work in Cystic. That's a win-win-win situation. Thank you again, our Dr. Yan Yun, for the insightful presentation.
So I'm very excited to introduce our next speaker, Lindsey Kugel. She comes to us with a wealth of experience in nonprofits and startups. She's held a founding role in many of the impactful startup organizations. One of them is the Google Wellbeing Learning Team. Another is the Green Building Council of Israel. Other examples include a clean tech firm and a sustainable home improvement firm. So these are just a few examples of what Lindsey has been involved in. She's also been a leader in a plethora of social impact organizations. And while she's doing all this, she's maintaining a 20-plus year mindfulness practice. For the last 5 years, Lindsey has been a director of public programs and outreach and also staff teacher at the Search Inside Yourself Leadership Institute. This institute was born from the flagship program, Search Inside Yourself, and that was actually born at Google in 2007. It was so successful that 5 years later, the Leadership Institute was established, and now it has a reach of over 30 countries and 100 cities. And this continues to grow every day. So with that, I'd like to extend a warm welcome to our next speaker, Lindsey Kugel.
Thank you very much. It's just a delight to be here with you all. And before I start talking at you more, I would like to get you talking to each other. So in a moment, I'm going to ask you to turn to someone next to you and just spend a couple of minutes talking. If I can have the next slide, please. So we're going to just get into pairs and speak for a couple of minutes. And I want you to reflect on these questions. What do you love about working in medicine? Or if you happen to not work in medicine, what do you love about where you do work? And what are some of your biggest challenges? And just notice, as you're doing this conversation, sometimes you're talking and sometimes you're listening. So please turn to someone next to you and go ahead. another 30 seconds or so. And you can bring your attention back up to the front of the room. It's an alive topic for a lot of us. So, for those of you here up front, let's bring the conversations to a close. It's nice to hear that there's so much energy around these topics. So for those of you up front that I can hear, maybe just shout out a couple of things that you love about working in medicine, a couple of words. Empowering patients, thank you, that's beautiful. Other things. Giving hope, yes, and you guys are doing a plethora of that. Transforming bodies, minds, both, I suppose. Great, thank you. And then same thing, a couple of challenges. What comes up in the challenges realm? Getting out of your comfort zone. Great, thank you. One more time. All I heard in that was money, but the constant driving, yeah, that's an important one. One more, maybe. Burnout, thank you. Yes, absolutely. So we're going to be addressing a few of these challenges in a little bit. But next, I just want to remind us, often when we come to a new situation, right, a new speaker or a new patient or a new meeting, our minds are still in that transition. Our bodies are present here, but our minds might be elsewhere, right? Thinking about Dr. Yoon's wonderful talk and the data that he gave us, thinking about what's for lunch, right? Our minds might be somewhere else. So I want to take a moment to invite us to arrive here right now and appreciate this beautiful space that we're in, appreciate the people we're sitting next to, just allowing us to be present for what's here right now. Taking that stop. So a little bit about why I'm here and what I hope to bring with you all. So my name is Lindsey, and as they mentioned, I'm from the Search Inside Yourself Leadership Institute. And a little bit about Search Inside Yourself. As she mentioned, it was originally developed at Google for stressed out Google employees to actually manage better the high pressure of the moonshot environment, right? How do you maintain well-being when you're doing everything at a 10x scale? And over the first 5 years of the program, they found that it made such an impact not only on employee productivity, but also on employee well-being, that the Search Inside Yourself Leadership Institute was founded in order to bring the program out into the world. And our mission as it stands today is to make emotional intelligence and mindfulness practices and tools accessible and practical for all. So that's what we're all about. And I do have a long-term mindfulness practice, and it was reinvigorated when I became a mom 6 years ago, and it's my constant practice with my kids. And I feel really fortunate to be able to work in a place where I can hopefully connect people to their own experience and to others. So a little bit more about why we're here. There we go. It's a VUCA world, and I feel that there are no one who understands this better perhaps than those in medicine. Volatile, uncertain, complex, ambiguous, I imagine these are situations that you're probably facing on a daily basis. And furthermore, this is, as I was doing the research before coming here, I found a number of studies across different countries that said that between 32 and 46% of physicians are experiencing at least one symptom of burnout, one of these 3 key symptoms of burnout. And further, I was speaking with a good friend of mine who's Dr. Glenn Komatsu. He's the chief medical officer at a pediatric palliative care facility in Southern California. So he's familiar as much as anyone with the challenges and stresses of the medical profession. And he said, you know, we're just so task-oriented and so task-driven that we forget to connect. And that really touched me coming from him. And so that's what I hope to speak to today. So one of the things that can contribute to this kind of stress in the working environment is a sort of state of autopilot, right? And what do I mean when I say autopilot? There we go. Yeah, there are different traits that we kind of associate with autopilot. So attention, as I mentioned earlier, being in the past or the future, being distracted. There are so many ways to be distracted these days with our phones and all of our notifications, less aware of what's going on in the present moment, and acting based on habit patterns. And so the key about this is that it's actually running on autopilot is taking away our choice of how to respond in any given moment. And so we like to highlight that there's a different way to live. This is Viktor Frankl. He was a Holocaust survivor and a prominent psychologist, and he wrote A Man's Search for Meaning. And his body of work was summarized by Stephen Covey in this way. Between stimulus and response, there is a space. And in that space lies our power to choose our response. And in our response lies our growth and our freedom. So by moving away from a state of autopilot, moving into a state of presence, we actually reclaim that conscious choice of how we want to respond to our environment, how we want to be with any patient that we're working with, or the kind of presence that we want to bring to our colleagues. So how do we get off autopilot? It might not surprise you, since I'm here to talk about mindfulness, but it's mindfulness. And what do I mean when I talk about that? There are a number of definitions of mindfulness. And when I'm referring to it, I'm speaking about a series of practices, active practices, that are focusing on being aware in the present moment. And to sort of double click on it a little bit more, being aware in the present moment with an attitude of acceptance and curiosity. And so a couple of words about, in practicing mindfulness, the idea is that we're moving from that autopilot state to being more aware. Oops. So a couple of words about mindfulness. If you search mindfulness in PubMed, it's that hockey stick. We see numerous publications over the last few years and increasing all the time in neuroscience, in modern psychology, utilizing mindfulness and seeing what the differences can make. And of course, one thing that they're noticing is that practicing mindfulness over time will have neuroplastic changes on the brain. One off-cited study that I love is they compared novice meditators to those who had been practicing mindfulness meditation for years and years. And they compared their brain activity, specifically in the limbic system, the amygdala, when they were experiencing a pain. So in this case, they had an electric shock. They were hooked up to a machine to give them a mild electric shock. And what they found was both the novices and the folks who had been practicing meditation for a long time experienced the pain with the same intensity, right? So in the brain, the pain matrix lit up to the same degree. They experienced that pain with the same intensity. But for the novices, for those who had not been practicing meditation, the anticipatory stress and the post-pain stress were much greater, whereas with those who had been practicing meditation, it was almost zero. So this is just a testament to how, over time, mindfulness practice can reduce our stress reactions to whatever our environment is throwing at us. So let's talk a little bit about it, and then we're going to do it. One thing is that when we talk about practicing mindfulness, we like to emphasize that there are a couple of ways to go about it, and we think these are really important to be complementary to each other. One is dedicated, right? So like going to the gym, we set aside time to sit in meditation or to practice yoga for some people, or to practice mindful listening, which is an exercise we'll do a little later. But actually taking that dedicated time and the discipline to sit down and do a practice of mindfulness. That's an important piece because it trains our brain over time to then be aware and be present at any time. And I think an important part is integrated practice. So day to day, in any moment, remembering to come back to the present. And I'm going to give you a couple of little tools, we call them micro practices, to make it easy to bring something like this into the present moment, where you don't just have to be sitting in meditation for 2 hours a day, but you can actually continue to exercise this as you're going about any day-to-day activity at home with family or at work. Okay, so, sorry. So in a moment, we're going to do a practice, but I want to walk you through the process first. So we're just going to do a focused attention practice, and this we like to call it attention training, because we're actually simply training the attention to be in the present. And we'll use the breath as the object of meditation. So the process is, we start off by following the breath, and we'll pick a sensation that makes it most prominent for us, and focus on that sensation, and that's the practice. And then, inevitably, we see distraction. Whoops. Distraction, right? Our mind will naturally wander. And this is, I want to stress this because people think, oh, my mind wanders too much, I can't sit in meditation. But that's the whole point. Your mind will wander, and it's becoming familiar with that natural inclination of the mind. It's part of the reason that we do mindfulness practice. So distraction will happen. It's not a question of if, it's a question of when. And it might be 1 second after you start focusing on the breath. Then the real moment of triumph is when you notice that you've been distracted. And it could be, again, 1 second or a minute or however long later, like, whoops, I'm not thinking about the breath anymore. So we notice the distraction, and then reorient the attention to the breath again. And this cycle happens over and over and over again, and that is how the brain training happens. So that's what we'll be practicing. There it is. Thank you. So let's do this for a couple of minutes. So if you have anything in your hands, you don't have to sit in any certain way, but if you have anything in your hands, I'd invite you to set it down and just let yourself sit at rest. And sit in a position where you can be both alert, but also relax the body. And then your eyes don't have to be in any particular way. You can be looking at me if you want, or looking down. And just notice that you're breathing. And you might feel that most strongly in your nostrils, or the air hitting in the back of the throat, or your belly rising or falling. Wherever you feel that most strongly, use that as like your anchor to stay with the breath. There's nothing to do right now but this. And if you notice that your mind has wandered away from the breath, that's great. With a gentle, grandmotherly kindness, bring it back. And each time you breathe in noticing the in-breath. And you breathe out, noticing the out-breath. Training your attention to continue to return to the present. And taking one final deep breath, you can shift your body and return your attention to the front of the room. And we like to talk about this as a practice that, again, can be done for 5 minutes a day or 10 minutes a day. You know, it started at Google, and our founder, Chadming Tan, he said, everybody wants to know, what's the minimum I have to do to make it effective, right? The engineers, tell me what's the right amount of meditation to make this effective. And his answer is whatever works for you, whatever you can do. The hope is, once you practice it, there might be some benefit. And to test it out in the laboratory of your own experience. That's really all that they ask. So this is an example of a dedicated practice. And again, by doing this cycle, by practicing this long term, that can help support our ease with which we deal with difficulty and the stress responses. And I promised micro practices. So next slide. This is a quick micro practice. So this is a 3-breath practice. And the whole idea is, right, what I've just done with you is more of a dedicated thing. You sit down, maybe you could do it at your desk or in your car or something, but it's something that you are sort of sitting down to do, and it's pretty clear that you're doing it to other people around. I like this kind of thing because you can do it in stealth, right? Nobody has to know around you that you're practicing mindfulness. You can simply take 3 breaths. And I think it's super helpful going into a meeting or seeing a new patient. Anytime there's a transition, it can be really nice to do this kind of thing. So I'll say it, and then we'll do it. With the 3 breaths, on the first breath, use your attention like a laser focus and bring your attention to the breath. And on the second breath, relax the body. And then on the third breath, in your mind, asking what's important now. Just bringing that attention to the moment. So let's do this now. Taking that first breath, full focus on the breath. Second one, relax the body. And the third one, what's important now? And this can be used anytime, like I say, in stealth, to cultivate that ability to continue to bring that present moment awareness throughout your day, whatever you're doing, wherever you are. So far we've talked about stress and working with mindfulness as a way of reducing stress and being able to choose our response. I want to get to another piece that we saw earlier, which is around emotional burnout, right? So how to work with emotional burnout. And this, you know, I've been so touched by all of the speakers so far and the kinds of work that you all are doing as medical professionals in disaster relief, working with really challenging situations, patients who are having a really hard time. And it can be really easy, right? Our brains naturally empathize, right? That's what we do. We see someone in pain, and it's natural to have a reaction that is similar to if we were experiencing that pain ourselves. And this is a phenomenon that's been borne out in the neuroscience research. And if we focus on that pain, that can lead to a distress response, right? Of course, if we see difficult things over and over again and just focus on how challenging it is for the patient, over time that can really wear away at our own emotional balance. So this is just a slide about activation in the brain regions where empathy, so when we're experiencing empathy, right, when we're seeing pain and relating to it within others, that it lights up the pain matrix in our own brains. But when we take it one step further and do a practice of compassion, and this can be an act, but it can also be a mental practice of compassion, that shifts the activation to pro-social regions. So basically engendering more positive emotion within ourselves. And so the idea is that by practicing this helps us enable sustained long-term ability to connect with challenging situations and people who are going through a challenge. So this is another clinician singer out of the Max Planck Institute did a series of research on empathetic distress versus compassion. So again, with empathetic distress, this is where we're experiencing empathy over and over again, seeing pain and connecting to that pain, but it's characterized by self-related emotion, stress response, withdrawal, and non-social behavior. So a lot of times you might hear of empathy fatigue or compassion fatigue. That's people sort of turning in. And then poor health and burnout. But again, when we're actively practicing a compassionate mindset, and I'm going to speak to this more in a moment, we see more other-related emotion, more positive feelings of kindness, and then approach and pro-social motivation. And that's so aligned with what you all are doing here at Tzu Chi, taking compassionate action, and then having better health. So let's see. Yeah. So this is a quote from Thupten Junpa, who was the translator for the Dalai Lama and also helped to found C-Care at Stanford. And he says, having compassion for others frees us from fearing. So it turns our attention outward, expanding our perspective, making our own problems part of something bigger than us that we are all in together. So I want to give a short compassion practice, another 3 breaths practice. I see there are photos being taken, so I won't go yet. So next slide, please. So this is another 3 breaths practice, but this is about a shift to connection. So there are kind of 3 components by people who define, sorry, go back. So there are 3 components as defined by people who work in the compassion field. One, of compassion. One is mindfulness, right? So one is simply being aware and being present. So we've started with that as our foundation. The second is a feeling of common humanity, right? Identifying a feeling of common humanity. And so we talk about seeing similarities between others. How can I look at the person that I'm with and recognize that in some way they're just like me? And then the third piece is to offer a kindness, right? So in this case, in the micro practice, we're simply talking about offering that in the mind, right? Wishing someone well, wishing that someone would be happy, wishing that someone will have a good day. When we did this program early on at Google, someone from outside of Google came in and we did this module, and it was a multi-week module, and they went back to work after getting the compassion piece. And then came back the following week, and they went up to Chadmeng Ten, who was one of the founders, and said, I have been working in a place for 7 years. I really don't like my job. I really don't like the working environment. But I went and did this compassion practice where I wished everyone who passed my desk that they would be well, that they would be happy. And I had the best day I've ever had in 7 years at my workplace. So just that mental shift, right? There was no action actually taken in that, but just that mental shift was enough to change that person's whole perspective on their day-to-day. So this micro-practice is kind of highlighting those 3 points that I mentioned. In the first breath, settling the mind, so becoming calm, focusing on the breath. Second breath, seeing a similarity. This is something we often do thinking about a specific person, and so that's a useful thing. Just find any similarity that you can and note it. And then the third, offer kindness, right? may you be happy. I hope that person has a good day. Whatever works for you in your mind. So we're going to do this exercise in a minute, and what we're going to get into is mindful listening. So stay right there. So I'm going to guide us through a mindful listening exercise. It goes forward so quickly. We like to have cute animals in our slides. So I'm going to get you into pairs again, and this time it does need to be pairs, so if you were in a group of 3 before, make sure you're with one person. We're going to have a person A and a person B. And we're going to offer our mindfulness of the other person like a gift of our attention. So person A is going to talk. They're going to talk for about 2 minutes. And person B's job is going to be to listen. And really, as person B, I want you to take that same quality of attention that you were giving to your breath earlier and actually give that quality of attention to your partner. And really treat it as a gift. Everybody here, your time is incredibly valuable, and your time is a gift. Your attention is a gift, and you can treat it that way. So person A talks, person B listens, and then I'll ring a bell and we'll switch. So person B will talk, and person A will listen. And then each time we do this, I will guide us through a quick shift to connection practice. So I'll guide us through that 3-breath practice we just saw a minute ago. And see what it's like to both listen and to talk in that kind of a feeling. Okay? So let's move forward one little bit. Yeah, that's good. So we're going to... Oh! Why does it go? There we go. So we're going to speak to, those are the prompts in the purple there. What's surprising me lately in my life is, or the kind of person I want to be is, or anything else that speaks to you, but we like these prompts because people can usually speak to them. And so I'd like you to go ahead and break into pairs, and person A is going to be the person who traveled the furthest to get here. And you'll go ahead and person A will talk for 2 minutes. And let's go ahead and quickly do our shift to connection practice. So let's take 3 breaths. So looking at your partner, relaxing the body, seeing a similarity, and offering kindness. Go ahead. So person A wrapping up. Person A wrapping up. And let's take those 3 breaths together. So come to silence. Take a first breath and settle the mind. With the second breath, see a similarity with your partner. And with the third breath, offer in your mind some kindness to them. Okay, now person B, it's your turn to talk for 2 minutes, and then we'll have a free flow conversation. Go ahead. So person B coming to a close. Person B wrapping up. I think there are good conversations going on out there, which I'm delighted about. So person B wrapping up, and let's all take just a quick 1 breath together. So great, thank you. So now, can you hear me? Are people out there, you can hear me? Yeah, okay. So now, since each of you have now done a monologue, I'd like to give you the opportunity to talk together about what this experience was like. So what was it like to be fully listened to? And what was it like to have the floor for 2 minutes? And just talk about that between the two of you. Free flow conversation, no rules, whatever you like. So go ahead. Okay. Thank you, and thank your partner for their attention. And let's take a collective breath. Now, a couple of quick call-outs. What was that like? What was it like to be listened to completely for a couple of minutes? What was that like? Shout loud. It was nice. Great. Relieves the pressure. Great. Relieves the pressure of what? Stress. Okay. Energy? Yeah. Great. What was it like to talk for 2 minutes? Was that nerve-wracking to anybody? Little bit? Yeah. It's weird when you know you have somebody's full attention, right? We're so busy on our phones or what have you all the time that when we're actually receiving someone's full attention now, it can be a little, right? A little daunting. And it's interesting to notice sometimes if we're having these conversations and are we trying to impress someone or entertain someone or, you know, whatever it is, or can we just be present and say what comes up? So imagine this listening exercise, bringing this kind of full attention to patient, right? Your patient or your colleague who's going through a really challenging time. And in each moment, bringing it the attention it deserves, and then from there, choosing how you will respond from a place of kindness. With the help of recognizing our common humanity, recognizing all of the things that we do have in common. So next slide. So you've seen this already, but remember how it feels to connect to others. If you remember nothing else except from this talk, remember how it felt to connect with your partner. Remember how it felt to bring that full presence to them and to have that presence be returned to you. So overall, what we're talking about is that mindfulness can help us move from that autopilot state into awareness. And when we're aware, we can become both aware of our own bodies and what's stressing us out and our choices that we make and how we can move to more conscious choice, and also brings our awareness to others. And in that awareness of others, we can connect to our own empathy. And then by practicing that compassion, by remembering our common humanity, recognizing our similarities, and offering kindness, we can sustain that connection over time, right? Having compassionate mindset, thinking about how we can be of service of others, and then, of course, as many of you are already doing, taking compassionate action. And in doing so, then be able to sustain that connection over time. Sorry, go back one more. And then find ways to practice both integrated and dedicated. So if you can, sit in meditation and practice that flow, right? Practice returning each time to full presence with the breath. And again, it can be 5 minutes when you arrive to work in your car. Or I used to do every time my husband and son left the house, they would leave and I would sit on my balcony and wave to them. And then before going about my day, I would sit for 5 minutes, just have that be my cue to have a quick, dedicated practice. Those kinds of things can make a big difference in how we show up then for the rest of the day. And then, so those are the dedicated ones, and then the integrated, right? I saw some of you taking photos of the micro practices, but those again can be done anytime in stealth, and especially in transition from one place to another. And it's a way to make sure that we're really arriving wherever we are, really taking space to be ready for what we're going to see and do and how we'll respond. So that's what we hope, is to find both dedicated and integrated ways of practice. Next slide, please. And this is the summary of what we did today. So, 3 rests practice, right? That's our micro practice of the mindful breathing. A full mindful breathing, could be 5 minutes, could be 10 minutes, could be an hour. Mindful listening, so bringing that full attention. And this is something that's really beautiful to practice with family, the mindful listening. If you just sit and, set down everything and listen to your spouse or your kid, there's such generosity in that, and they'll notice. And then that short compassion micro practice, the shift to connection, something you can do anytime, particularly particularly when there's something stressful going on. How can I shift to connection with this person who's in this stressful situation with me? So with that, let's close out with another quick mindful breath practice. So allowing your attention to settle and follow the breath. And you can bring to mind all the people who are here in this room with us. And bring to mind the collective energy and the collective action that they represent around the world. And offer gratitude. And dedicate all of the benefits that we get to worldwide healing. Thank you so much. It has been such a delight to see what all is happening with Tzu Chi, and I'm really inspired by all of you and the work that you're doing. So, much appreciation.
Thank you so much, Lindsey, for that wonderful presentation. I'm sure that a lot of these mindfulness practices will come in handy, especially for those of us in the healthcare field. It is always such a dynamic, fast-paced environment, and these will help us cope with the stressors that we face. And by doing these practices, we'll be more engaged, build more meaningful interpersonal relationships, be more productive, and have better performance at work and in our personal lives. So thank you again to Lindsey for these wonderful activities. I think they really helped us bond with one another just now. And with that, I'd like to turn it over to our lead attendees who will be taking care of the announcements for our next piece, which is lunch.